This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Today's webinar is entitled The Impact of Trauma and Stress on Young Children and How to Help. Our presenter today is Courtney Clark. Courtney is a mental health therapist who has been working with the early childhood population and their caregivers in the home setting since January of 2015. She currently uses an evidence-based trauma-informed treatment program in her work with children and caregivers. Courtney currently supervises graduate students and conducts certification trainings for professionals in the same evidence-based program. Courtney is working at the Behavioral Clinic at Penfield Children's Center in Milwaukee, Wisconsin, a current SAMHSA-funded trauma-informed site. It gives me great pleasure to introduce to you today Courtney Clark. Courtney?
Hi. Let me know at any point if you can't hear me. All right, so we'll get started right away. So the first thing, when we're talking about young children, for my purposes here at Penfield, we serve really young children, and our behavior clinic, my department, serves specifically ages 0 to 6. So that's going to be kind of my primary focus. Some of the information I give today is probably applicable to a little bit older, but when I say young kids, I mean under the age of 6, just so everyone's aware of that. So we're going to start off with just kind of looking at our state and some of the prevalence of trauma and stress. So some listeners out there are probably familiar with the ACEs study and the concept of ACEs. For any who don't know or might need a refresher real quick, ACE stands for Adverse Childhood Experience. And there are a lot of studies out there that kind of track these over time for populations. They span anything from abuse and neglect to some more kind of common stressors kids might experience, like divorce or a family member with alcohol or substance use concerns. So there's kind of a whole spread. But when we're looking at Wisconsin specifically, the most recent data I was able to pull from a reputable website, I got this from the DHS website from the state, was from 2017 to 2018. So this is just kind of a snapshot of our local population. So one or more ACEs within the state of Wisconsin, here's kind of a breakdown. So over 50% of individuals in the state of Wisconsin have experienced at least one adverse childhood experience, and it's a pretty even spread within that chunk if you look at the yellow, blue, and pinkish red chunks of this graph for 1, 2 to 3, or 4 or more ACEs. The kiddos that we work with, we do screen for stressful events, and there are children under the age of 6 who will quite frequently, I think our average is 4 to 5 reported stressful events, and we work with kids who could have up to, a dozen stressful events already occurring, which is kind of mind-blowing if you think about the age of some of the kiddos we're working with, 2, 3 years old. Then if we're looking at the breakdown by income, this kind of shows it is a pretty prevalent and even spread across income levels. There is some variation, but for the most part, this kind of illustrates that there isn't a specific group that is necessarily more impacted or less impacted. It's kind of an even spread across the population. But then when you look at race breakdown, there is a clear difference between people who identify as white and having a higher percentage of 0 ACEs compared to other populations. At our clinic, we serve all of Milwaukee County, so most of the kids we're serving fall into a category of a non-white ethnic or racial identity, and so we are serving primarily the other groups on this graph. So it is a pretty prevalent fact by race. And then when you're looking at health, so if we're looking at how trauma impacts kids, just from medically, here are some statistics on some of the co-occurring medical concerns, some of the major ones. I did recently attend a conference where some research was presented where they did show, I think it was research from 2021, they show, just because these are co-occurring doesn't mean it's predictive. So that's one thing to keep in mind. Just because a child has been through stress doesn't mean they're going to have these health concerns, but there is kind of a high rate of them both happening for individuals. And then here's where kind of my clinic comes in, and my focus is the co-occurring mental health concerns. So again, this is for Wisconsin. And if you look at this graph, you can see for all of these major mental health diagnoses that occur across a person's lifetime, the more ACEs, or adverse of childhood experiences, or potentially traumatic events someone is experiencing in childhood, the chances of them having a mental health concern or diagnosis throughout their lifetime increase. And particularly if you look at when we go above 2 to 3 and then 4 or more, it increases the likelihood substantially. So this is why we focus on early intervention in our program, especially when it comes to trauma and stress, because if kind of left on its own, we could see, higher numbers of this, where our goal is to kind of intervene early in hopes that we can help individuals early in their life trajectory, so that we're not seeing quite as much of this concern later. So this piece is going to be misconceptions about children and trauma that might be floating out there. When I'm in a group in person, I have people shout out true or false. We obviously can't do that on this webinar, so I'm just going to say whether it's true or false when the statement comes up on the screen. So the first potential one is true or false: children won't remember a trauma that has occurred. That statement is false. So even very young kids remember things. Sometimes how they remember is a little bit different, or it might be skewed compared to how an adult remembers an event, but kids, even the youngest children to infancy, can remember stressful events or trauma that have occurred in their lives. Children can experience trauma in the womb. That is a true statement. So a fetus can experience stress neurobiologically while in the womb. If there is chronic stress, the fetus will adjust to that stressful input, and it can actually kind of impact how their neurodevelopment is occurring. If a child were traumatized, it may not be easily identified. That is definitely true. It can be very difficult to spot signs that a child is being impacted by stress or trauma, especially due to level of development, which we'll get into later in this presentation. Children can continue to be impacted by an event that occurred early in childhood, later in life. That statement is true as well. Everyone responds differently. There's no set recipe or set trajectory that an individual goes through of how they might be impacted by something. Some kids seem fine for a while, seem like nothing has changed, and then all of a sudden, weeks, months later, it suddenly comes up for them. So there really is no hard and fast rule for how someone is going to be impacted by stress. And then the last one, trauma occurs as a result of bad parenting. That one's another false. So this is something that sometimes on the surface, it could look like a child's behavior is, quote, out of control, or that the way they're reacting or acting in a situation, it may seem like, oh, this parent doesn't know how to control their child or something like that. And it's really not. It could be something has been going on for this child, and they're just kind of trying to process or deal with what's going on and are not in control of their own behavior. So symptoms can occur regardless of the parenting style or what the parent is doing with the child. Okay, so we're going to look at types of stress here. So there are three kind of major categories of stress as we're looking at it for young kids. The first would be positive stress, which is kind of an ironic statement, but positive stress are the brief little spurts of stress that we have as a part of normal development. Kids experience these things early, the stress of trying to learn to crawl, where they just kind of continue to fail again and again and again. And that stress can be good because it pushes them to complete the milestone. If they never had to try, they might not learn to do that task. It builds resiliency and promotes growth. So positive stress are the kind of typical stressors you go throughout development that kind of push that area of growth. First day of school, toilet training, different things like that most kids will go through in their lifetime. Tolerable stress. Tolerable means, it's not necessarily a positive or a good thing, but it's something that we can, cope with, or it doesn't completely overwhelm a child's ability to function. So some common ones that occur is like a death in the family, an injury, a broken bone, something like that, a natural disaster like a tornado, something like that, or even, something like 9/11, especially for families who weren't, in New York City at the time and were experiencing it from a distance. It's an extreme stressor, but it's a kind of one event that if, depending on how it's handled, a child might not be completely overwhelmed and react to that to the point of needing intervention. Then you've got toxic stress. So that is something that is kind of like ongoing, chronic, does create a feeling of helplessness. And it can impact kids in a lot of negative ways. So things like chronic instability, emotional inavailability, of a caregiver. So if a parent is going through an addiction, so the caregiver is there but isn't able to respond to or care for the child appropriately, abuse or neglect, are all examples of toxic stress. And then, when we're looking at kids, it's important to keep in mind that what they view or feel as toxic stress or overwhelming is not necessarily what we as a logical or rational adult would view as overwhelming. So it's important to keep in mind when we're looking at young kids that these categories can be kind of fluid. So something that seems like, just a typical thing like moving to a new home or, birth of a new sibling or something like that could be a little more stressful for a child than we anticipate. Or a child might react a little bit stronger to an event than other members of their family. So the types of trauma, when we're talking about trauma, types of trauma that occur, acute means one isolated incident or a single exposure. So examples would be a car accident, a death, witnessing a shooting occur in the community. Chronic stress would be something that occurs more than once, or there's an ongoing exposure. So ongoing abuse, intimate partner violence or domestic violence, as it's sometimes called, living in a neighborhood with a high violence rate, neglect, things like that. And then when we're looking at complex trauma, that's a combination. So it's a combination of above events. It could have a wide range of effects on children. So a lot of times, unfortunately, the kiddos we're working with in our program are most likely to fall into the complex category where they maybe have something ongoing as well as a few acute incidences. So they're not often simple to understand like what a child's experience is. There's often a lot of factors going on. And then there's intergenerational trauma. So that is how trauma experienced by one generation impacts the next generation. So that could impact future vulnerability. It could impact both learned behaviors and attitudes and biological factors, so stress response. So the messages or modeling kids are getting from caregivers to be, to potentially be mistrustful of certain groups or of others, or being wary of asking others for help. Kids may learn based on that, as well as biological, the stress response system that could be kind of pervasive if you have generation after generation experiencing the same thing. Some things to note, for example, poverty can result from experiencing trauma. If something huge happens in a person's life and they end up in a situation in which they're finding it hard to make ends meet, or they're in an unstable situation as a result of the event, but it in turn increases the risk of experiencing future traumas. So that's kind of a cycle. As well as racial discrimination can be categorized potentially as an intergenerational trauma. Some people put that in its own category. Sometimes it gets put in this category. There's a lot of different discussion going on about where that fits, but that's another example of something that's ongoing across generations of individuals and families. So when we're looking at young kids specifically, there are a lot of things that influence how a child is going to respond to and react to something stressful. So kids have kind of a unique response because they are in this developmental stage of really rapid change. Just think about how different a 1-year-old versus a 2-year-old versus a 3-year-old is. Their brain development is going at such a rapid pace, and their ability to understand and process things is quite different. So a couple of key ones are cause and effect. Kids have a really difficult time at this age understanding cause and effect in a logical way. Sometimes they don't understand unless something is very concrete for them. What causes something? So them understanding, for instance, what causes a parent's addiction is going to be very hard to wrap their heads around because it's not often just one single clear thing. Another example is that often kids tend to over attribute things to themselves at this age. So for example, the way they interact with the world, they think about a lot about themselves, which is not a bad thing, but that's just this age group. So, you know, something could happen where a family gets in a car accident and a child's reasoning could literally be, you know, I wore these shoes today, we got in the car accident. If I wear these shoes again, we're going to get in another car accident. So their ability to kind of have clear logic is not always quite there. So that can be a challenge. They also have very limited vocabulary and speech and ability to express themselves. And so it's very hard to know if something could be impacting a child. Most 3-year-olds aren't, you know, coming to their parent and saying, you know, I'm having a really hard time dealing with grandma passing away. They're not going to say it like that. It will come out in other ways often, which we'll get to later in the slideshow. And then one other unique factor with the young kids is their relationship with adults and caregivers is still so prominent. They still rely on adults a lot for their day-to-day functioning. And so if that relationship is disrupted by a trauma or stressor, that can cause a huge impact for a child's day-to-day functioning. All right. So some risk factors. Not everybody who goes through a stressful event develops symptoms or has some kind of clinical need for treatment. That's adults and children. Many times we work with kids where we're working with multiple kids in the house and they've all been through the same event, and yet every kid reacts differently. So there is no kind of solid way to predict something like that, but some of the things that can be sort of looked for would be, first, what was the severity of the event? Reaction to things like, you know, a sudden move to a new home or a single event car accident or something like that versus, you know, the car accident, was it a fender bender or did someone have to get rushed away in an ambulance? You know, what is the severity? Proximity for kids. So were they in the car or were they, you know, on the street and saw it happen? And one thing to note for them as well is not only their own personal proximity, but their kind of main attachment relationships proximity. So young kids, because they rely so much on those caregivers, if they see something happen to their mom, their grandma, their dad, uncle, whoever it is that's raising them or spending the most time with them, seeing something like that happen to someone close to them, even if they themselves were not in danger, could cause the same response as if they themselves were in the event. So keep that in mind when we're talking about the little kids as well. How caregivers react to the event. Kids kind of look to the adults in their lives to see kind of how to respond and what's safe and what's not safe. And so how the caregiver is reacting or coping could influence the child's reaction. The number of traumatic events the child has experienced or is experiencing, the more we pile on, the more likely they are to become overwhelmed. And then their available resources. So things like coping skills, their ability to process information, community resources, are they able to get treatment if needed, and what's their family support like? So when we're looking at symptoms in young kids, here are some of the most common ones. So on the left column, we have externalizing or behavioral symptoms. So those are the ones that often lead to kids getting referred to our program. Those are the in-your-face behaviors, particularly extreme temper tantrums, aggression, acting out things in play, sleep issues, adult language, short attention span. Those are the things that are kind of harder to miss, and those are usually what get kids referred to our program. Interestingly, it's not often that they're getting referred saying, oh, I think they're having a traumatic response. It's usually this child's behavior is out of control, and trauma is not necessarily thought of as the reasoning behind it. The emotional symptoms on the right are much harder to see because they're kind of going on inside the child's head, inside their body. So anxiety, fear, anger, the emotional kind of responses, those are much more difficult to find and to notice unless you're specifically looking for them. So here are some examples we'll go through in the next 2 slides. Kids often who have been through trauma and are having symptoms of trauma often get misdiagnosed. So if you look at this slide, the ones I've highlighted in pink, hyperactivity and short attention span, those are common expressions of trauma symptoms in kids. And that also is the kind of trademark for ADHD. So a lot of times we'll see young kids who have been through a lot of trauma and are having a lot of trauma concerns who happen to also present, hyperactivity and short attention span, and they may be being mislabeled or misdiagnosed by a provider or a doctor or a parent or a school or whomever. And nothing is working to target those symptoms, while, giving a child ADHD medication if they don't truly have ADHD, but in fact they have trauma, isn't necessarily going to actually treat the issue. So we do often see some misdiagnosis because it looks like a lot of other things in this age group. Another example would be here, use of adult language, aggression, temper tantrums. These are the kiddos who sometimes get misdiagnosed as having ODD or conduct disorder concerns. So it's really important to know when you're working with kids or have kids or just whatever capacity you're interacting with kids in, that these symptoms are just kind of how kids express themselves at this age, and there could be a different route there than we automatically assume. On the more positive end of the spectrum, resiliency factors. So we can't prevent what a child has experienced. Sometimes we can't, we don't even know what a child has experienced, but we can work on resiliency factors. So the things that have been shown to help improve kids coping following a trauma are things like a strong attachment or caregiver relationship, seeing the adult caregivers in their lives use coping skills and model healthy ways to cope, a kid's temperament. So like their general kind of whether they're a more anxious kid by nature versus a more laid back kid by nature can influence, whether they're gonna be able to cope easier than other kids. Caregiver attunement, if anyone's unfamiliar with the word attunement, that means can the caregivers or the adults in the child's life accurately understand where a child's behavior is coming from. So can an adult see a child crying and know, okay, he's crying because he wants his way, he's crying because he's scared, he's crying because he's hungry. Can they pick out the reasoning behind what the child is doing? Family and community support are definitely huge. So support systems that can help alleviate some of the stress of dealing with a trauma and parenting young kids, and who knows what else the family has going on. If kids have a history of successfully handling positive stress, so, through that development, have they handled other minor stressors in their life before, that can build up a kind of a self-confidence and also coping skills that, okay, the brain's not completely overwhelmed by that. Is the child safe? If we can establish safety, that's kind of a huge factor for kids. And then positive caregiving or parenting skills to kind of help them feel safe within the limits that they have. All right. So I'm going to put this in the simplest way possible. I am not a neuroscientist. The brain stuff, a lot of it can go right over my head, but these are kind of the main takeaways. I'll try to make it as simple as possible because it gets very complicated. But how trauma can impact a developing brain. So the main 4 areas. Your amygdala can get bigger. So if you're under chronic stress, it can actually impact your brain structure. So amygdala can get bigger. The amygdala is in charge of controlling your emotions. So if the amygdala gets bigger, you could think of it like a house alarm that's too sensitive, right? It goes off over something that we might consider nothing. So it kind of triggers a higher response for kids. So they may seem more emotional or react more impulsively. Hypothalamus, that's what releases your stress hormones. So it kind of is working overtime and releasing more adrenaline than you necessarily need, because it has learned over time there's so much stress that you need to kind of keep on your toes, keep that fight or flight going. We see it slow down the frontal lobe development and prefrontal cortex. That is the part of your brain that is responsible for concentrating, decision making, planning, and impulse control. Most young kids this is still in the early stages of development to begin with. They don't have great skills in those areas to begin with. So when you add in chronic stress and that becomes even slower to develop, that's where some of that hyperactivity and impulse control issues kind of come up. Kids are not able to kind of curb their impulses or stop their behavior ahead of time. And then the hippocampus becomes smaller. That's the part of your brain responsible for integrating memory. So if you think about that, learning would be a huge factor. So kids under chronic stress, that part of their brain is not developing as quickly as it should, because their brain is so focused on fight or flight. It's not integrating other types of learning. And so we might see kids having a harder time remembering information that they're learning in school, for example. If there's any parents or teachers or whomever out there listening, my favorite book that explains the brain in a way that's actually easy for people and kids to understand is called Whole Brain Child, and it's by Dr. Dan Siegel. If anyone needs that information, I can give it to you at the end of the presentation. His book is excellent. So this is probably familiar to a lot of you out there, but just kind of a visual representation of sorry, it's telling me I have a network connection issue. Hope you can all still hear me. This is a visual representation. If kids are going through trauma or stress, these bottom two, the green and purple rungs on this pyramid, safety and basic needs, are not being met. The higher pieces of the pyramid are just probably not happening. A kid's brain does not have enough energy to do all of these things. And learning and school really do fall into those upper areas, achieving your potential and things like that. So learning and school can be pretty heavily impacted by chronic stress and trauma. When we're working with young kids, there are some benefits and challenges. The challenges being lack of language, like I mentioned. The rapid change can be a challenge, just because it's like you finally find something that works for a child at age 2, and then by age 3, it doesn't really work anymore. They're always changing and getting smarter. So there's also limited interventions for this age group that are out there, particularly for kids under the age of 4. We're one of them, but there aren't a ton of options out there like there are for older kids and teens and adults. There is kind of a lack of history, a lack of previous coping that kids can draw on, and it is easy to miss trauma or stress. The benefits, however, are just that early intervention can hopefully change that trajectory and help instill kind of more positive resiliency earlier on. Because it is such a crucial period for brain development, we do have a potentially easier time rewriting patterns for kids and teaching them skills that they can learn a lot more quickly and integrate a lot more quickly into their brain and into their memory than maybe those of us adults would at our age. Healing happens a lot within the parent-child or caregiver-child relationship, which means adults do have some kind of control over helping children improve with their symptoms, whereas they might not at a later stage of development. And the kids themselves are very highly engaged with caregivers and with therapists. It's pretty easy to get kids to buy into therapy activities at this age. They're pretty excited about things still. So those are some benefits of working with this age group. And when we're looking at therapy, sometimes we can't do anything to prevent what's going on the risk factor side. So we can control what's happening on the protective factor side. So we can work with families to really kind of bulk up the protective factors when we can't control some of the risk factors going on for families. So this next portion is what we can actually do. So no matter what capacity you're working with children in, whether you're a parent, foster parent, daycare provider, teacher, whomever, working in a school, anything, there are ways to support children that anybody can kind of contribute to. First being adjusting our expectations. So it doesn't mean having no limits, but depending on the child and where they're functioning at, we might want to start small and do baby steps versus expecting a huge change all at once. Not making assumptions. So just because you see a behavior, like we showed with the behavior symptoms list, it's not necessarily an oppositional or intentional behavior when you're seeing it. So just not making assumptions about the child's intention in what they're doing. Providing consistency is huge. Those will be in some upcoming slides, but basically routines and responding in the same way every time is hugely helpful for this age group. Engaging in nurturing activities, so kind of bolstering up those positive activities in their life with the caregiver or with a teacher or whomever. Setting clear expectations, we'll talk about providing control when appropriate, we'll talk about in a few slides. And one thing that's sometimes tricky for adults when we feel uncomfortable with what a child has been through, it's hard to think about a young child having gone through something stressful. And so sometimes our initial response is to try to change the subject or topic. But when appropriate, in an appropriate environment, letting the child kind of talk about whatever it was that happened and kind of allowing them to say it out loud. Sometimes when kids try to talk to us and we change the subject, we send the message that they shouldn't be talking about that, and then they may have a sense of shame or guilt about it, or they may avoid bringing it up again. They may kind of bottle it up a little bit. So allowing a child to talk to you about something, or if it's not the appropriate time, finding a setting in which they could talk to someone about it, whether it's a school counselor, a therapist, whomever. And then if in doubt, find, ask for, recommend help for families if you're just not sure how to handle something. Okay, so some ideas to challenge when you're interacting with kids who have been through stress, or even if you don't know that they've been through stress, this is kind of still helpful. Some things that we're kind of, we might have come up in our own mind when we're interacting with kids. First, I've never hurt this child, therefore they should know I'm safe. That is not necessarily going to happen for kids who have been through stress. An example being, when we go do home visits for families, sometimes the last lady who they didn't know, the last stranger who came into their house, took them and removed them from that parent and put them into foster care. And so when I come in, they may be wary of me right away. They don't know me, but their history has told them that I could be dangerous, or I could do that to them again. So keep in mind that it's not personal. The next one is just, if I'm understanding and kind to a kid who's been through stress, they will appreciate that and behave better for me. Unfortunately, not really. Kids actually often act out more with adults they trust and that they feel safe with, because they know they're not going to be, put in harm's way. And so that's one to challenge as well. For kids who have that history, sometimes it's the people they trust the most that they act out with the most. Kids can have low boundaries when they've been through a trauma, like physical or sexual abuse, for example, or just moved from home to home. And so keep in mind that could be kind of a red flag for the child's ability to keep themselves safe. So that would be something we would target in our program for treatment as well. For me, if I show up at a kid's house the first time and they run up and say, I love you, and give me a hug and try to get in my car with me, and that happens more than you would think, that's a kind of an instant red flag that this child may have been through some things, because that's not always a typical behavior for kids, even the really young ones. And then the last one, if a kid has been through something traumatic, I should try to make them happy. Sometimes we get to a point where adults feel bad for a child, or are so sympathetic to what they went through that they kind of don't set limits or just try to keep them happy in any way they can. And usually that's not helpful for them either. They need that structure and routine just as much as any other kid. And not setting limits isn't really going to set them up for success either. So when we're looking at behavior, how do we tell if something is related to trauma or not? And this is kind of the endless question that we've run into a lot when working with kids. So a couple of points to kind of go through is just looking at where the behavior might be coming from. So is this something we would expect from their age group? Does it happen at the same rate as other kids their age group? If we respond in a consistent way, will the behavior go away on its own? An example would be sometimes when kids first start school, they're kind of testing the limits and trying to figure it out, but after a few weeks, they settle into that routine a little bit. If there is or isn't an extreme intensity, example being temper tantrums, every kid has temper tantrums. Most kids can dial it back by like 15 minutes as long as they're not getting their way from that temper tantrum. Kids who have been through trauma, if they get really dysregulated, can keep going for 30, 45, 60, sometimes more minutes. That would be considered high intensity for their age group. And can you figure out a motivation for a behavior? If the behavior is clearly set out by, I wanted a cookie, mom said no to the cookie, I'm gonna, start having a tantrum. That's kind of a very clear motivation. Sometimes with trauma, we can't see the motivation right away. And we'll get into that here in a couple slides as well. So what we would do if we can't see that motivation would be tracking patterns. So we've done this at home, in homes, at schools, daycares, where we might have people just kind of jot down what was the child doing right before the behavior? What did the behavior look like? What time? And how did you respond? Something like that. Sometimes it's hard when you're in the moment to see those patterns until you kind of take that step back and look at it. So that's kind of an easy thing anybody could do if they're having a child that they're really not sure where some of the behavior is coming from, is just literally take a couple of days and track what's going on. Sometimes we can identify what's leading to the behavior. If we can decide, is this something the child has to learn to deal with, or is this something that they can completely eliminate? So for example, if if something happened to them, at a specific family member's home, and the plan is for them to have the family to cut that individual out of their lives, we don't have to go to that person's home anymore. The child's not really necessarily going to encounter that trigger. If the trigger is something like fearful, I've had a few kids fearful of the bathtub, well, we can't just never bathe. So we might have to use treatment to kind of deal with helping them cope with those triggers. Here's a sample of a chart. This is kind of a common way that we do it. So we'll do the day and time. So, for this kiddo, for the example, child is playing, then they start kicking out of nowhere. Then later it's nap time, cried, ran off, hid, disturbed other kids, getting ready for bed, crying, having a tantrum, and then during sleep, waking up screaming and crying. So on the surface, the nap and bedtime thing could just seem like any kid not wanting to go to bed, right? But when you're looking at all the stuff together, we can see a pattern, and maybe it's not that they're just trying to avoid sleep because they don't want to, maybe it's that something scary happened to them at night previously, or maybe they have nightmares and they're trying to avoid having those nightmares, and so they don't want to go to sleep. So this tracking can kind of help us pinpoint, is this something that has an easy to follow cause, or is there a pattern? And if there's a pattern, how can we kind of intervene to help the child with that? I can't say enough about the importance of routines for any kids, but especially for kids who have been through stress or trauma. The reason being that at any given time, a kid's brain is scanning for what's coming next, what's coming next, what's coming next. You could even, hear that out loud. If you're working with little kids, they'll be like, when are we going outside? When are we going outside? When are we going outside? 400 times. So they're constantly trying to figure out what's coming next. For kids who have been through stress or trauma, a lot of times a lot has been pulled out of their control. They feel overwhelmed, and their brain is even more sensitive to scanning for what's coming next in case they need to be alert for any safety concerns. So routine can kind of help settle that part of their brain down. If they know what's coming next, what we're doing after that, what we're doing after that, and it's predictable, that part can kind of settle down. They can spend their mental energy or their brain's energy on other things, like learning. Certain activities during the day might be more difficult. We kind of talked about that in the last slide. So having those routines can help kids prepare for those triggers or can help them cope through them. So we might, in therapy, build coping skills into the bedtime routine if we know a child has a difficulty going to sleep. They also help kids develop independence and self-help skills. For kids who have been through a trauma or stress, most kids don't have a lot of control over their day to begin with, but kids who have gone through a trauma feel completely out of control a lot of times and will grasp for it in any way they can. And so by having a routine that a child can follow along with, we make a lot of picture charts so the kid, if they can't read, can still follow along with what the routine is. It can help them regain a sense of control over themselves and their day. And so it's important to kind of understand how that's going to help them. All right, so transitions can be really hard for kiddos, that unpredictability of ending something and moving on to something else. So providing warnings. We use a lot of timers to create a concrete indicator that we're about to change tasks. Visual schedules with pictures are really, really helpful. The childcare here at Penfield uses a lot of songs when they move from room to room or things like that. That's just if you feel like it. They do get stuck in your head, and you do kind of walking in and out of the grocery store singing may make you look a little strange, but if you're willing to do it, definitely go for it. Kids like having something to focus on during those times of routines. One thing that can be a little bit easier and doesn't involve you like making a big spectacle is a comfort item. So having something they can hold while walking to or from school or getting on and off the bus. Whether it's a stuffed animal. I've worked with a kid who just had like a stress ball she used. Sometimes the kids at the child care here at Penfield literally just hold the teacher's clipboard, and that kind of helps give them something to focus on, gives them something to ground them here to the moment versus just trying to, do that scanning of what's coming next. So there's a lot of different ways you could handle it. Comfort items like stuffed animals and things like that usually work the best for the little kids. All right, so when we're talking about limit setting, we want to do so in a sensitive way. Limit setting is still important, but we don't want to unnecessarily trigger a child who has been through something stressful. Sometimes we know what a child or a family has experienced, sometimes we don't. And when we don't, it's better to err on the side of caution. So for example, a lot of times for kids who just have temper tantrums when they want their way, our clinic might recommend limiting attention and just kind of going about your day and letting the kid kind of calm themselves down. A child who has been through neglect, that could be very triggering for them because they have historically had caregivers who are not responding to their needs. And so we don't want you to ignore, that child necessarily. So we want to still have limits, but we're going to have to maybe modify how we're going to use those limits. And kids who have experienced trauma may test limits further than other kids because they're trying to really test if you're going to respond in a safe way or if you're going to do exactly what people in their past have done. So for trauma treatment and when we're working with kiddos who have experienced trauma, stress, we use a time in instead of a time out. So time out is what we might use for a child when they're being aggressive, to get them to kind of just regroup before re-entering a situation. Time in, we might do something a little different, like we might help the child use coping skills. We might have the caregiver sit nearby instead of just letting them sit on the couch and walking away during the timeout. And we might provide verbal like check-ins, like I'm still here, we can go back to playing when you calm down, something like that. So we might do a little bit more interaction with the child who has been through stress than we would for just kind of your typical kid, where we might recommend a timeout for that child. So coping skills that I mentioned as a part of the timeout, anything that helps the child re-regulate and calm down. So with the little kids, the simplest are often the best. They usually have one, maybe two that they gravitate towards. And so there's really no reason to keep switching it up. If they like counting to 10, then we're just going to do that every time. We use a lot of deep breathing. So we'll do like a picture of a flower and a picture of a candle and have them smell the flower and blow out the candle, things like that. Visuals are really helpful because kids, if they're stressed, if they're up here with their emotions and we're sitting there being like, breathe, you know, they're going to just either ignore us or they might do it too quickly and actually kind of hyperventilate a little bit. So having those visuals helps keep them grounded in what they're doing. And the goal is to refocus and kind of calm their body, calm their energy so that they can calm down. And with the little kids, adults should always be doing this with them. They're not able to do it on their own most often. They might be able to when they're calm, but when they're upset, they're going to need somebody to do it with them and kind of almost coach them through it pretty much every time. Very few kids get to the point under the age of 6 that they can just do it on their own. The good news is if you set up these skills now, they could get to the point where they do it on their own as they get older, but not at this age group. For the young ones, they have limited language, so we do a lot around labeling feelings. This is something anybody can do, you know, with pictures. We use a lot of emojis or pictures that we get, coloring pages, things like that, and starting with the basic ones. There's ways to integrate that into play. There's ways to integrate that into their day-to-day. If they're watching TV shows or books, or, you know, I've had kids, you know, point out to me how their dog is feeling that day. So really just modeling that and helping them learn the language for it. For redirection for kids, we often recommend using can-do language. So that would be phrasing a redirection in terms of what you do want to see versus what you don't want to see. We kind of encourage caregivers to give a direction once and then try to help them follow through completing the task versus repeating ourselves a lot. Kids are really good at trying to outsmart us, and they'll wait until they know they've hit that like end of the line, like whether it's someone got up to come and help them, or the tone changes, or we've yelled, or we counted to 3, we got to 3, you know, so trying to avoid that pattern. But can-do language, meaning what do we want to see versus just saying no, no, no all the time. Just because sometimes kids are not good at going from, I'm not supposed to do this, what am I supposed to do instead, and then making a good choice. So phrasing it like, I need you to get off the table, we need to keep our feet on the floor, we need to use our walking feet, we need to sit on our bottom, you know, those types of very clear directions versus just saying like, stop running, stop jumping, those types of things. When we're talking about sexualized behavior, sometimes kids who have been through trauma will either exhibit sexualized behavior or talk about things that maybe you wouldn't expect them to know about. That would be a good one where if you are noticing that and you're not a mental health professional, to maybe get a mental health professional involved, because that can be kind of a tricky area. But if you do work with kids, trying to stay calm, trying to respond with a calm redirection. We can't do that. That's just for adults, you know, whatever it might be. Oh,
It looks like Courtney's computer is having a little difficulty at this time. So let's just hope that she's able to come back online in just a moment. Courtney, can you hear me? Can you hear me, Courtney? Courtney, we can see your screen, but we can't hear you talk. For those of you on the call, please let me know if you can hear Courtney. I would appreciate that. I know you can hear me, but if you can let me know if you can hear Courtney at this time and I just can't, that would be helpful.
Okay, I'm back. Can you guys hear me still?
Yes, I can hear you now. Thank you very much.
Oh my gosh.
Yep.
I'm so sorry. Okay,
Yep.
I'm so
Yep.
sorry, everybody. My computer just completely restarted out of nowhere. So
Yep.
I ran to a docking station. As you can see, I'm now in a completely different location. I just like ran to my desktop and I'm doing it from there, if that's okay with everybody. I'm so sorry.
Nope, we can hear you now. We can hear you now. Go ahead.
Okay, perfect. So for the sexualized behaviors, trying to remain calm, trying to avoid using shaming. Kids don't really understand the significance of what they're doing, and they also, if that's something that they've experienced, we don't want them to internalize that sense of shame. So just trying to kind of redirect them, and this would be one to potentially refer them to a service to specifically target what may be going on there. And maintaining appropriate boundaries can be really important. For a variety of reasons, different traumatic events, kids' boundaries may have been violated, whether it's sexual abuse or physical abuse or just changing caregivers frequently. So we want to make sure we're modeling appropriate boundaries for kids. So what we want, maybe it's we have to change when we're only in the specific room of the house, or we're going to model asking for hugs or being allowed to say no, things like that. So we want to make sure that we're modeling for them and not just because they're young and cute and sweet, letting them just kind of hug strangers or things like that. We want to make sure they're having appropriate stranger danger a little bit. That control that I mentioned, forced choice is a really good one. This goes for any kid for power struggles. We recommend this a lot, but this is also for kids who have had control taken away from them in some way. Allowing them control where appropriate can really kind of help offset that feeling. So giving 1 to 2 options, but within what the adult is okay with. So do we want to have goldfish or apples for snack? So candy isn't an option, but they still get to choose between the two. Or which of these 3 shirts do you want to wear to school today? Just finding any and every way you could to appropriately give a child control, especially if they're a kid who's striving for it in other ways, through behavior, or through attempting to control siblings or things like that. This is a good visual of when we're looking at trauma. We do this with parents a lot because it is hard to remember in the moment, but trauma is not like the flu where an event happens and kids have symptoms and then all of a sudden at some point they hit a point where they're all better. It's not like that. A traumatic event happens, they might have symptoms, they might, learn to cope or receive therapy, and we get to minimize those symptoms, but then a new trigger happens and symptoms go way up again. And it is really kind of an up and down system. An example would be a child who has experienced death of a loved one. The family may grieve, the family may kind of come up with systems to remember that person, the child may be doing okay, and then some major thing happens, like Christmas comes around where that person should have been there, things that remind them, and then those symptoms kind of go back up and down. So this is helpful to keep in mind, because in the moment it can be kind of frustrating to see a kid who was improving suddenly go backwards. But that's just unfortunately not kind of how this works. It's a very roller coaster type improvement model. If you're working with kids and kids do say something unexpected or say something kind of intense for a young child that you're like, okay, I'm not sure how to respond to that, having a go-to phrase can be very helpful. One I always use is just like, thank you for telling me that. Because sometimes we panic in the moment and either don't respond or try to change the topic, and kids get the message then that that wasn't okay for them to talk about, and they may stop telling people how they're feeling or what happened to them. So make sure you kind of have a go-to so that you say something, and that something is kind of supportive of what they've just said. So things to keep in mind, remember, no matter what capacity you work with kids in or around kids, your interaction definitely matters, even the small ones. Kids may be reacting to things that you're not aware of. We don't always, if you're a professional or in a job where you're working with kids, we don't get the history. Even foster parents don't get the history a lot. We don't know. And so erring on the side of caution is usually best. Kids may not show that they appreciate what we're trying to do, like limits. They don't necessarily in the moment act like they like them, but it can be helpful and can make a difference. A child with broken trust with adults may continue to test the boundaries no matter how consistent you are. Keep it up anyway. Kids need that predictability. They need to see that you're going to kind of stick with being a safe adult, and they're not going to get you to push them away, essentially. It doesn't always just impact the child. The stress and trauma impacts the caregivers too. So also be patient and just empathetic with the adults in the child's life too, because they're going through something as well. Even if it's that their child experienced something, the adult may be impacted by the fact that their child experienced that, even if they didn't go through it themselves. Being trauma informed in general doesn't just mean being educated on trauma. It also means, actively making those choices or modifying how we're interacting with kids and families to be more sensitive. That's, really being trauma informed in action versus just, just knowing the information, but without making any changes. Because sometimes kids do make it a little difficult to be patient. They test that a little bit. So keeping that in mind can be kind of helpful. So I wanted to make sure we had some time for questions. I know our little hiccup there and me running down the hallway at my work to try to get the computer on here kind of ate up a couple minutes. So I'm sorry I rushed through a little bit there at the end. Are there any questions out there? I think Bonnie was.
Yep, I do have a couple of questions for
Perfect.
you. One was, sometimes it's difficult to determine whether it's a stressful and trauma situation or whether it's the symptoms of something like ADHD or depression. What would be your suggestion of how to navigate that issue?
So first would be trying to kind of find the root of the symptoms you're seeing. Like, is there a clear pattern, like kind of like we talked about? Sometimes it is a bit of a trial and error situation where you may have to try things are helpful for for certain groups of kids, and then if that doesn't work, then maybe we would go on to something. If there is a real significant question mark there, then potentially referring for an evaluation with a professional just to determine if ADHD, for example, is one that a professional should be able to kind of parse out if they're doing a thorough evaluation for a kid. And just also paying attention to what does not work. Did we try all of these different things? Sometimes because we work with such young kids, we're the first program a family has been involved with. And so if we get through our whole program, for ADHD, for example, if we get through our program and we're still seeing those symptoms, even though the kid is in a safe and consistent environment and people are redirecting him appropriately and all those things, then maybe, and it's still happening at school and at home, then maybe there is something more going on and we might refer on for further evaluation.
Okay, thank you. And we have another one. Do you train social workers and court personnel? Court often is causing trauma instead of knowing how to address that trauma. What are your suggestions there?
Yeah, we do training. So we've done trainings. We offer if you're interested, please feel free to email me. We offer a full day training, like a 1-day training for professionals of any capacity. We have trained court personnel here in Milwaukee in the child family court system. For some, it wasn't a mandatory training. People volunteered to attend in a full day version of all this information. I just gave you guys the briefest overview I could, but we do an entire full day about this stuff, 8 hours, and talk about it in depth. And we've done trainings for social workers as well. And then particularly if social workers are conducting therapy, so if you have a LCSW or and are actually providing therapy to individuals, we also certify providers in our training model, which is called Early Pathways. So we can certify providers. That's like a 2-day training that we do, 2 full days, and then 12 months of consultation afterwards. So we do train individuals, but as of yet, there hasn't been any like huge push through the whole court system to get everybody trained. It's been like a voluntary basis, and it's just been in Milwaukee so far.
Okay, this is another one that follows up on your training. Do you train foster parents?
We have not trained foster parents in like those full day ones. We will do community like speaking engagements and do a little more in depth of like what we just did, like for a 2 or 4 hour presentation. We also work with like provide treatment with foster parents a lot, but we haven't just specifically done a training for a full group of foster parents. But I would love to do that. I think that would be lovely. If people are interested, definitely let me know. I'd love to get that going somewhere. I think it would be helpful. But most typically we're directly providing services with foster families in Milwaukee.
And then we have one last comment
Sure.
as part of a question, and that goes back to the sample training chart that you provided. The question was, do you think it appropriate to add another a column that would be called result column? In other words, in other words, what happens when those things all occur? Would that be appropriate?
Yeah, definitely. So I assume I think we're talking about the like tracking form where it was like the day and time, the behavior, like what was happening before, what the person did.
Yes, I think
if I'm wrong, let me know.
Yes.
Yeah,
Yes.
so yeah, the results, sometimes we'll have parents or teachers also write down. That was just kind of like a sample for the screen, but we'll have them write down like, did it work? And, how did the child respond to that? Were they able to calm down? Did they just shut down? Because those are two completely different things. And sometimes if it's really not clear, our therapist might go observe a child as well in the classroom if we're not getting a real clear answer. But so if you're in a school system, tapping into the school counselor to do maybe an observation if it's still not, yielding any results. But yeah, the results of it would be helpful to know as well, like to figure out what's effective and what's not effective.
Okay, that is the end of our questions. Courtney, is the best way to contact you through the email that you have on that last slide?
Yes.
Okay, great. And is there any last comment that you would like to make?
I don't think so. Thank you for being here with me today. Please let me know if you have any other questions or just follow-ups about the trainings or anything like that. Thank you for bearing with my technical difficulties that I had earlier. I appreciate everyone taking the time to listen to me speak today.
Okay, that's great. There is one quick question. The
Sure.
person wanted to know what the name of that book was that you suggested. I believe it's called The Whole Brain Child. Do you have the
Yes.
author's name?
Yes, so it's Whole Brain Child, and the author is Dr. Dan Siegel, S-I-E-G, oh God, wait, I have it. E-L, okay, it looks like this. You can't read the writing because of the window in front of me, but there's a child head on the front, and it's spelled S-I-E-G-E-L, and he's a medical doctor, but he does a really good job of explaining kids and how their emotions work in a way that both the child and the adults can understand. So I use that one a lot with families.
Well, Courtney, thank you so very much for your wonderful presentation today. We greatly appreciate it. This will conclude our webinar today. We'd like to thank all of you for joining us. Please be reminded that Wisconsin Facets has over 100 trainings and webinars for the year 2022. And please feel free to check out our website calendar and register for any of the upcoming trainings that you may be interested in. Also, please watch for the short evaluation that'll be coming your way after today's live webinar. Again, Courtney, thanks so much. Thank you all for joining us, and be well, everybody. Have a great day. Bye-bye.